Hello YouTube, welcome back to my treatment room here in Bendigo. Today we are going to be looking at correcting a forward head posture. These days it's got the cute little nickname of a tech neck. So correct posture for our upper body is to have our ears stacked over our shoulders and shoulders stacked over hips. But with a lot of the things that we do today, it brings everything forward, means we're looking down, we're looking forward, and we're losing that nice C curve in our cervical spine, which is basically our suspension. It takes the weight of our head, lets the muscles in our neck be supports, but also big movers, and helps support that posture. The weight of our heads can be anywhere from 4 to 6 kilos, but the problem with tech neck and that forward head posture, for each degree forward, we can be adding anywhere from 12 to 27 kilos of weight to those structures. And as you can imagine, time under tension, those muscle structures become really quite tight and quite firm and quite short just to try and handle that weight. So when we lose that C curve through here, it's forcing our head forward as everything here gets shorter. So today we're going to be using our bodywork techniques, that deep pressure stimulation. We're going to try and lengthen those fibers, create a bit more space in there and allow that C curve to come back. So we're going to start off with my favorite ever bodywork technique, and that is just pressing down on lev scap. So for those of us who are a bit of a stress head, we live with our shoulders up around our ears. So starting with this one, we're going to use the scapula as our guide. We're going to roll up into having the pisiform, so that little bone at the bottom of our little finger, and we're looking for that lev scap tendon, and we're just going to rest there. We're going to give those structures time to accept the pressure, to warm up, to soften, and as they begin to accept the pressure that we're going to give, we can start pushing them away. So as a practitioner, it's nice, I get to just lean on someone for a while, but as the person receiving, it's helping just press those shoulders down and away from our ears, creating some of that space. And by pinning and holding, we're giving those fibers time and the tissues time to change state, become a bit more gel-like, a bit more space, a bit more fluidity, and less of that conjection. That's not the word I was thinking of. The word where you squish everything together starts with a C. Congestion, that's the one I was after. So as it's softening, I'm slowly just increasing the amount of weight that I'm having on that tendon. So lev scap starts from the back of the ear and it comes down and it connects to the corner of the scapula. It's that tugboat muscle we've talked about before. It slightly starts that shrugging motion. But when it comes to tech neck and that forward head posture, it's that shortening through the top and the pulling up through the bottom. It's forcing that scapula up and forcing our heads forward. So by getting that to lengthen, we're allowing that shoulder blade to fall back and allowing our head that space to come back to where it's meant to be. So as that gets nice and warm and nice and soft, we can come out with the palm of our hand and again find it with just our thumb, get a bit more specific about finding those spots of solidness under our thumbs. And again, I'm trying to press right into where it's attaching onto that corner of the scapula. And from here, as we tune into what we're doing, we're really searching for what this particular lev scap is feeling. Just because we find the right region doesn't mean we always find the right spot for the area that we're pressing. So when it comes to this sort of technique, we want to make sure that we're just using little shimmies, little movements, trying to find that correct area of tension. How's that feeling?
You're on the spot.
That's what we're looking for. The other thing that we can do once we're in here is we can do a bit of a scoop, a bit of a clean out. So my thumb right now is resting right on the edge of the attachment on the scapula. So I'm going to be scooping my thumb in and away, pushing towards the spine to really sort of try and clean out that crevice. But I'm not going to do it with a big movement. It's not about changing the position of my thumb, but more about changing the position of the pressure. So right now I'm pressing down and into the scapula to create the scoop. I'm just going to move my own body, pull it more to the side, and move that pressure now pushing towards the spine. Does that feel okay, Dan?
Mm-hmm.
So now I'm really trying to create that stretch right at that attachment level. But from here I can feel a little bit more going on. So I'm going to release the lev scap and we're going to move on to the next muscle that we're looking at. The big one, it's the upper traps. So our trapezius muscles make a big diamond through our back. The fibers go in 3 different directions. So your lower traps are coming from the spine towards the shoulder. Your mid traps are the spine going outwards, and the uppers are connecting from the top of our the occiput, the occipital ridge, and they're coming down to the spine of the scapula, but they also wrap around and become attached to the clavicle on the front as well. So when you think about it, these are big, all things shoulders, moving the shoulders, being stuck up and around. So again, we want to be pushing down and away. But when we're looking at the upper traps specifically in regards to technique, we're going to be tracing where they're attaching along the spine of the scapula. So I'm going to come in to where I can feel the outer point. With these bodywork techniques and the deep pressure simulations, we're really looking for the bony landmarks in the body as our portals of entry. Like we're looking, where are these muscles going? Where are they starting? Where are they attaching? So in this case, I've come across to the spine of the scapula. I'm starting at the point close to the AC joint. And again, I'm going to take my time, ease in. But this time, rather than pinning and holding, I'm going to be slowly progressing across that spine. That pressure okay, Dan?
Yep, pressure's good.
How's that feeling?
You're finding some sore spots.
Now, technique doesn't just come from using technology. It can be caused by many things, all of which are generally related to posture. It can be the way you breathe. It can be that you have eyesight problems and you're leaning in close to have a look at stuff. Your sleeping positions, weird body positions that you have to get into while you're working. But it can also come from like depression or low self-esteem. You're sort of wanting to curl in on yourself. One of my favorites is just people that are tall. You spend your day walking around talking to people that are shorter than you, so you're bending down to compensate and not realizing that you're putting all of this pressure through the neck and through the top of your spine from the weight of your head. So I'm not staying true to the anatomy 100%. I'm following what I'm finding in the textures of the muscles. It's not about an exact science. It's where's your point of pain? Where's your point of solidness? What do you need pressed on? What needs to change? So I just followed up that thumb move with, again, using my pisiform, just coming across. Wasn't feeling too congested there, but a follow-up move that I like to do is the opposite direction. So I just start with my palm as close to the spine, really trying to find that ridge of the upper traps and just push that shoulder slowly back away from the ear. It can be a little bit of a test of patience when we're doing body work. Just really trying to go slow and listen to the fibers that are under your hand. But it is so much more rewarding to know that the body has let go of that tension on its own. We've not forced anything. We're not leaving the client in a position where they feel good for a short period of time, but in a couple of days, the body's just going to go, oh no, hang on, I'm meant to be tight, and lock back up again. We're giving it that time to really change under our hands. And also when we're dealing with the upper traps, because it does create this ridge for us at the shoulders, we can slip our thumbs in and attack it from under as well and from the front. I would love to move the camera to show you a better angle, but I don't trust myself to get it back into a good position. One of these days I'll get a cameraman in here to follow me around so it can really show you what we're doing. But again, I'm just following the line of the traps, trying to find those points of solidness. And as I do, just have a little bit of a play with them. See if they're going to melt for me. And Dan's been coming to see me for a while. His body's getting used to this sort of treatment and tends to respond fairly quickly.
Indeed.
That feeling okay through there?
Yeah.
Beautiful. All right, so for the sake of the video, we're going to come out of that one today and we're going to hit the third muscle group that we're looking for the back. Tech neck is compounded by what's happening on the front as well. We're just looking at the back today, and we'll do another video of what's happening through the front. But the third group that we're looking at is the suboccipitals. So you've got a ridge here at the back of the head. Everyone can feel it. You just stick your thumbs in. When you're having headaches, you know that's where you really want to press. But for these suboccipitals, they're coming down and they're connecting to the spine. So when these are getting tight, they're really just pulling everything together. So we want to give them a chance to loosen up. So I'm going to start with my point of entry this time is where that ridge and the spine intersect. And I'm going to come just off to the side of it with my thumb. And again, not full force. I'm not trying to push his head off right now. Just letting my thumb trying to get in under that ledge. And as things warm up and let us in, we can start to shimmy our way across. Again, we're looking for the specific points of solidness for the client under our thumb. Some people, the points will be closer to the ear. Other people, it is really central here. But the important thing is that we take our time and we check everything so that our client gets the treatment that they need. I've been in quite a few massages where I've just laid there and I've taken what the expert has told me that I needed, but you get off the table feeling like, oh, they missed something, or they rushed over the spot that I really wanted them to hit. Whereas when we're going at this pace, you can tune into your client, and even if they're not very talkative, you can listen to the non-verbal cues. There's generally little grunts or twitches or something that give you an indication that you've hit the right spot. And when you get that feedback, you have the confidence to stay on it and really deal with the bit that they need dealt with. So I feel like I'm sort of coming up to a little bit of solidness here. Is that right, Dan?
Yeah, I can feel that.
So again, what I can do with this is I can shimmy along, move my thumb around, find different angles to hit it from. But what I really want to do is, same with the lever scap insertion, I want to scoop it out. I want to be really trying to clear this ridge. So I'm starting with my pressure from along the table, but to scoop it out, again, I'm just moving my body. My thumb hasn't changed position. It hasn't changed pressure. I'm really just moving the direction that the force is going in to create a nice scoop up under that ridge. And then I can shimmy along, just taking a couple of % off pressure. I'm not losing connection with the spot that I'm on, but moving a little bit to the side, and then I can do the same thing again. come out of that. You doing okay, Dan?
All good here.
So that's a first introduction to dealing with that forward head posture. If you have any questions or comments, please leave them in the section below. Next video, we'll be having a look at what's happening through the anterior neck, because when everything's being pulled forward, everything through here is going to be shortened, so we can see what structures we need to work on to lengthen through that neck, get that really nice posture back, ears over shoulders, and take the weight of our head off the rest of our body. So thanks for joining us, and I'll see you next time.